Take it away, Angela. All right. Well, welcome everybody. I'm not doing any big presentation. I just want to welcome you here. My name's Angela Elster, and I'm the president and CEO of the Vancouver Symphony Orchestra and the VSO School of Music. And prior to coming here from Toronto 4 years ago now, I was very much involved and continue to be involved with the Canadian Network for Arts and Learning. I've been on the board of directors for about 10 years, and I really I believed then, and I believe even more now, that the arts are so central to everything that we do, not only in healthcare, but in our daily lives. And I really believe that while the pandemic has been really, really difficult for us, it's helped the general public create an awareness of how vital music and the arts are for everybody. I welcome you here to the VSO School of Music. I'm thrilled that you're here. We rehearse and play and make music on the Coast Salish territories of the Musqueam, Tsleil-Waututh, and Squamish nations. We have a really, really compelling Indigenous council here at the school and at the VSO, representing those three nations, also an urban elder and Métis youth. And we work together to find truth and reconciliation, to find, we call it the path forward. So we have had one path forward on the Orpheum stage, curated by the Indigenous Council, and we have our second path forward coming up in June 2023. So I'm very happy to have you here. I'm so happy that the network, the Canadian Network for Arts and Learning, is beginning to expand across the country in person again. It's been really hard for us digitally all these times. So I welcome you to have some open, honest conversation and to be inspired. Thank you.
Thank you, Angela. So yes, come on in. Yes. I'm just gonna go back to the Canadian Network for Arts and Learning. Many of you are familiar, many maybe you don't know, but been around since 2007 and have done many of these kind of events. We want to bring the artist educators, teachers, artists together for networking, for information sharing, to build the sector, to support the sector, to grow arts education, not just in schools, but in communities. And so advocacy is something that we have been moving towards. And now during the pandemic, so we have held many of these in-person events pre-pandemic, about 30 of them, mostly in Ontario, but we did do a national tour series before, and then during the pandemic we switched over to virtual roundtable discussions, which were really helpful. And then of course at the end people were growing tired of virtual, but now it's, you know, a hybrid. So we're excited to be doing this. A really big project of the Canadian Network for Arts and Learning is our map of arts and learning. So because we want to have tools and resources for educators, for the community to find teachers, to find places where they can study. We also want artists to be able to find people with whom they can collaborate, work together, build partnerships, get ideas, get inspiration. So the map was that was one of the big ideas behind the map. And from our research prior to the map, we heard that the map was wanted. So now we are getting close to 10,000 contacts on Canada's map of arts and learning, and hope everyone is on the map. And I just wanted to show you now that we are moving to, and you're seeing my screen now, yeah. Now that we have during the pandemic, everybody was very concerned, of course, health and well-being, and now the lasting effects of the pandemic, and realizing, you know, everybody turned to the arts during the pandemic, and so we want that to keep going, and we want to show decision makers the value of the arts in addressing mental health, well-being. It's certainly not since the pandemic, that this is not a new concept, but it's certainly becoming more, it's getting a bit more clout of an idea within decision makers and governments, and we want to get some money to our artists and build programs and get the community out and help the community realize the value of the arts in helping them heal and whatnot. So now we are turning our advocacy efforts towards that. So and with that we are adding that into the map as well. So we have a new we, when people fill out their map forms, they can say if they have mental health and wellness programs, and then we are adding in, yes, come on in, adding in places for that people can search for that information, and we can show the scope of what's happening to decision makers, and we can we can share with everyone so they can use all of these tools within their own practice. So here's actually one contact that just came in today, actually, and they are their health and well-being through the arts, and this one is specifically for seniors. So I'm just showing you a map profile, and actually let me show you on Zoom because I excellent. Welcome, Daniel. So I'm just going to show everyone on Zoom as well, share my screen. So this is a map profile, if you don't know. This is Radical Connections is they work with artists working with seniors mostly, and you can see that what they offer, their arts disciplines, you can see their community programs here, who they're connected with in the community, and also a featured project that they have. And then all of these things are searchable on their own as well. So there's lots of different, you can look up lesson plans and different resources and that type of thing. So when I was researching for this series of hubs, that's actually how I found the Health Arts Research Center up in northern BC, and so very happy to be introduced to the work that they are doing. Um, I'll let, well, Marion is going to do a presentation on the kind of work that they do, but it's really well aligned with our focus right now, with where we know that the attention is going. So I do want to, at this point, welcome up Marion and Kelly, Marion Erickson and Kelly Roulette, who are our presenters for today. And really looking forward to. Marion is at the HARC, or Health Arts Research Center, and you told me what I was supposed to write it down.
I'll introduce myself.
Okay, much better. We're so pleased to have you. Thank you so much.
Thank you so much. Okay, so I just got to open this PowerPoint and let me see. Sorry, I'm just hoping, how do I get this? How do I share this with the presenter, with the online folks?
Share screen.
Share screen.
We'll just hit the green button there. And then yeah, there you go.
Okay, so let's just see how this, okay. Just close this. And then
another meeting. VSO programs here if you want to know what is exciting happening, but if you want free tickets to Symphony of Terror, that's our drag queen show next week. And we'll get some comp set up through the network, okay? Yeah, I wish I was going to be here. Thank you for being here. Did it.
Thanks, everyone. Thank you so much. So I'm going to make this really quick because Kelly has a really great video that she's going to share. So my name is Marion Erickson. So Hadi Hunesti Huazatil, Marion Erickson Le Susie, Susan Erickson Le Slu, Lawrence Paul Yachsalatin Le Sabah. Amasiu Desto. So I just introduced myself. My parents, so my mom is a teacher and my dad is an artist, and I just so happen to have become an artist who teaches. And so I work in the Northern Medical Program, mainly teaching practicing doctors and healthcare physicians and nurses and in all areas of healthcare in northern BC, specifically about anti-Indigenous racism in healthcare and addressing this very huge problem that the province is currently has been dealing with. And I've been working in this position since about 2018. So before the In Plain Sight report came out, and um, I work under the supervision of Dr. Sarah DeLeo, who is a professor in the Northern Medical Program. Um, and yeah, so I thought I would just start this by doing a really quick demonstration uh, of a lesson that I show some of the doctors, and we'll learn about HARC, and then I'll have a really quick. We're going to skip the discussion until after Kelly's video. All right. So I'm going to teach this lesson. So this is moving together. So the Dacus word for toes is Kayla Smite, and it means the berries at the end of my feet. The Dacus word for house is yo. The Dacus word for chest is also yo. The Dacus word for territory is ko. The biggest difference between these words is that the body parts can be owned and explained in the possessive form, and so can a home. But territory has a very different understanding. You can't own a ko. You belong to it. With this, I would just like us all to stand up and learn some Dacus words. And sorry, if you cannot stand, then please just point to a few body parts and I will teach you this very quickly. So we're going to do the first one, just saying the words, and then the next one, we are going to turn it into a sing song, which you'll all be very familiar with. So, atsi, a was, a gwat, a kayla smite, atsi, a was, a gwat, a kayla smite, a na, a do, a day, a la. Does anybody know what sing song we're gonna do? Okay. Atsi, a was, a gwat, a kayla smite, a gwat, a kayla smite, a gwat, a kayla smite, atsi, a was, a gwat, a kayla smite, a na, do, de, la. Now, if anybody work in healthcare, but if you work in peds specifically, this is a lot of great material for you. So yeah, feel free to sit down now. But yeah, so I've taught this to many healthcare practitioners who often think they know a lot more about the human body than I do. And I like to tell them that I know just one more thing than they do, which is a lot of fun for people who work very competitive jobs. um, so who is the Health Arts Research Center? So the Health Arts Research Center is a collection of researchers, collaborators from diverse disciplinary backgrounds and experience who are interested in synergistic and creative ways to interrogate the determinants of health disparities and to engage in critical anti-colonial strengths-based visioning and action to address the revival of health, healing, and well-being. A lot of times we use art. Well, actually, all the time we use art to achieve this. We do a variety of different types of workshops for different types of healthcare providers, depending on the need. So things we've done, we've written and edited and contributed to over 100 publications. We've trained, mentored, or offered professional development to thousands of people. We've secured more than $3 million in funding. Just to kind of put in a nutshell, we are a grant-funded organization, and we've been very successful with many of our grants and continue to have this success because of the demand for it in healthcare. I have mentioned before that this is the most effective way to address anti-Indigenous racism in healthcare. And it mostly has to do with the way that it's perceived by healthcare providers, but also because it puts people in a feeling of discomfort from the very beginning. We do things like this head and shoulders, knees and toes, because it does give kind of a feeling of discomfort right off the bat for people who are so used to a very what I call form line way of conducting themselves. So I think it's a lot of fun to do it that way. So without further ado, I just want to introduce Kelly's video, and we're going to have some discussion after that because Kelly's demonstration shows kind of how you can talk about health related topics, for example, grief and loss. And I'll let her, she can explain it better.
All right. So that was my film, My Mother, My Rock. Um, as a Ojibwe woman, I'm from Manitoba, but I've been living in Vancouver for over 40 years. Um, we like to incorporate our spirituality into our art, and I wanted to use death as part of the storyline because it's a kind of a taboo topic and people really don't like to talk about it. But I had such a wonderful, beautiful experience that it really healed me when my mother passed away because I was the youngest and people thought I was going to take it the worst. And it was an amazing experience. So, as an Aboriginal person, as a filmmaker, I was a former lawyer in my past life here in Vancouver. And we like to incorporate health and well-being and spirituality into our work. So if you have any questions for me or Marion, we're here. Thank you.
I think that it has a lot to do with culture. So I know Kelly and I, like Kelly's Ojibwe and I'm Dakef. The Dakef people, we call ourselves Dakefs because it means that people go by boat. But one of the nicknames for our people, the anglicized version of our like tribe name is the carrier, and it was because they thought that we had carried the bones of our ashes for or the bones of our ancestors for a year, which actually isn't true. It was somebody I was actually kind of messing around with an anthropologist. But when they asked what's in the bag, that's what they said. But we have our own, we have a lot of ceremonies that have to do with death and dying. So for some, I think it would depend on your culture, you know, like, and that's one thing that I had to learn even personally in cultural humility is, you know, I was so uh, I teach. I've been developing a DACF doula training curriculum specifically for birth. And my community gave me the directive that, well, you can't just do birth, you have to do death too. Like it needs to be holistic. And I'm like, so that'll be part of my PhD. This is part of my master's. But the thing that I had to learn, like humility wise, was somebody asked, well, what do you do when a baby is going to die? Like for your uh, community members who you're teaching like doulas. So what do you like the healthcare providers asked me, who should I call? And me not being Catholic, I said, ask them if they want a priest. And they're like, what? And I'm like, yeah, most of my people are Catholic. So see if they want a Catholic priest so they could do the last rites. Like you need to get that done right away. And for me to say that, like it took a lot of like because I have a lot of anger towards the Catholic Church because of the residential school system. But it did take humility for me to think about my people, you know, as Catholic people, you know, because to me my culture is the spirituality DACF culture. But when you're serving others, you know, you kind of think about their culture. So for us, like you don't mention the dead for a year after they passed. So that's something I teach the healthcare providers. You're like, okay, I know there was this like tragic death in the community like 4 months ago, and uh, their child or whatever is going to come and see you and get a vaccine. Don't talk about his dad. Like that very simple little thing, And so I guess it would be a cultural, for us, it's like we get a year where you don't mention that person who's passed away. Um, so it would be more of like just understanding from a cultural perspective, um, your from your own cultural perspective, and really doing some self-reflection there, and then thinking about like where like and that's what I think. I hope that answers your question.
Yeah, no.
But a lot of deep self-reflection, I think, is really what helps. And then always a collective community. If you can get a collective community around you, then that's really great.
Touches the tip of the iceberg.
Yeah.
Thank you.
Your comment? Okay. That was a very powerful film. I lost my grandmother to COVID and turned to painting to celebrate the life that was still growing all around me. Do you find working with health science challenging, with much of their focus on health outcomes and results?
So it is challenging mostly because of the way that their system is structured. So one of the things that we do is we kind of put exactly this curriculum, like exactly what we're doing here, and we would put it, say, for example, towards people who care for those in palliative care centers. So we would bring this kind of film there as a way to teach them about like spirituality, the complexities of Christianity and Indigenous communities, and bring it for a discussion like we're having right now. But unfortunately, their curriculum requires like certain things to fit into their criterias. So we kind of have to, for example, they have a list of learning objectives that they need, and they need it to be measured. And so they need to have a measure of success. And before the In Plain Sight report, there was a lot of apathy in the healthcare community, saying like, well, this isn't really a problem we need to address. We don't have any scale or measure of racism in healthcare, and therefore we shouldn't be spending so much resources addressing it. But now that the In Plain Sight report has come out, it's kind of, for me as somebody who does this work, it's been like the smoking gun that's really gotten this kind of teaching into healthcare environments. And having discussions like this, I think, is super helpful, especially if you have people who either are or were patients or are care providers. And I think it's really helpful and humanizing in a lot different ways than doing, for example, a case study on, like, say, for example, a racist incident that happened in the ER. We'll do a case study and we'll study it. That doesn't have very good results in terms of humanizing Indigenous patients, which is what racism is very dehumanizing. So.
That's really interesting about the measurables at the end of the course, and I can imagine that impact that you might have had there, just even changing the outcomes-based learning is also very impactful. I'm guessing, right? Do you know what I mean? Like more qualitative learning that you're bringing.
Yes, I find once you get people in science, people who've studied science their whole lives, once you get them painting, watching films, doing self-reflection, talking about themselves and who they are and where they come from, and about their perspectives, it makes them quite uncomfortable. And that is actually works really well. So when we start with for example, the head and shoulders, knees and toes article, it puts them in a place of discomfort. And then we start talking about race healthcare. So we would show this presentation, Kelly's film, in like palliative care to palliative care practitioners, and then talk about racism in palliative care. which
Mm.
I think is actually really great way to start having uncomfortable discussions by just making everybody feel uncomfortable in the first place. Works really well. um, I've also integrated some of their own teaching methods. So, for example, in our DACA culture, usually you just do like a round table when you do discussions, but because of the scale of how many people we're teaching, um, we can't really do that within the time frames. So what I've done was I basically started saying, well, if you're not going to ask questions, I'm going to call on you Socratically, and they respond really well to that. It's actually it works actually really good if I use some like kind of chameleon into theirs and kind of weave it in. It's been working.
Mm.
Do you ever find that the discomfort inspires resistance?
Yes.
How do you then, how do you disempower that? How do you inspire something other than resistance if that comes out?
Um, I think there's always going to be those who are just not interested in providing anti-racist care. It's become so a part of their. Some people don't even realize what some of their biases are racist. So a lot of times, what we do is we kind of combat some of the. I think it's called the cognitive dissonance and unconscious bias. So I always try and address some of their unconscious bias um, when I'm doing presentations and things like that that come with their practice. And yeah, I hope that answers your question. But a lot of times when you use art, um, I haven't run into doctors who haven't wanted to participate in the art part. They always want to do it, but they always want to do it really good because they're so used to doing everything is so I'm the greatest. My thing is going to be the best thing and it's going to be really great. So they always participate in the art, and that's what I think is actually really one of the more impactful parts of what we teach, because it gives them something to think about. And we usually use like very self-reflective um, methods to teaching art. So, like for example, the head, shoulders, knees, and toes. It's a song. It's a dance. It's a gets you thinking um, about a different way to think about the body, about connection to land, that kind of stuff. So one of our lesson plans was about how to make a medicine pouch. So I don't know if anybody's familiar if they've seen a medicine pouch, but it's usually made of leather. Sometimes has beads on it, and people wear it like around their neck on their person. So what I did was I created like this lesson plan about what it is, what might be inside of it, and what to do if you find one, like for example, on a patient in the ER, like because I know depending on the situation, a lot of times things that are fabric, they get cut off. And so it was just a very simple lesson plan as like, you know, for example, treat it like a rosary. Think of it as something that is like a living being, and that has a lot of prayers inside of it, and make one yourself. And so we taught them just how to make one themselves with this box that they can order in the mail in their own home, and sit in quiet reflection with themselves, um, and do what they want with it. And one of the healthcare practitioners who went to our previous beading workshop um, actually beaded on uh, their medicine pouch. So I thought that was like a really good way that they've been continuing with it.
And you say that it's some of it's national. You're kind of going a bit more national. Right now you're in northern BC, northern province. Or do you travel?
So the box project that I was just talking about is Northern BC centric. The curriculum is meant for Northern BC doctors, healthcare practitioners, that kind of thing. But our newest grant was from the federal government, and it is a national grant. So we're looking to create a national-wide curriculum. I am not leading that project. Like I said, we're grant funded, so I know a lot about the box. But our newer grant is headed by Nicole Bauer, and she is in Terrace, and I believe she would be the best contact to if anybody are more interested. But what it'll be similar to your map project, I think, but more like meant for practicing healthcare providers, practitioners, and healthcare healthcare. I'm like holistically healthcare. Yeah.